this young lady's going to let us do a video, but she comes in here with cyclical vomiting, and she has a history of using marijuana, and I think the diagnosis is hyperemesis cannabinoid syndrome. She doesn't get improvement with hot showers simply because she hasn't even known about it or thought about it, but that's typical for this particular syndrome. First of all, you're okay with me making this video as long as I mask your face, right? And can you tell me though roughly how many times a week you smoke marijuana? 4 times? 5 times? Okay. And then looking back at your medical records, you've been here multiple times or in different ERs with nausea and vomiting and belly pain, and that's exactly why you're presenting here today. So the purpose of this video is to really actually demonstrate the benefit of Haldol, IV Haldol. How sick are you right now, sweetie? Really bad? And are you having belly pain? Okay. And, you know, there's your emesis phase in there. So, all right. Well, we're going to be giving you the Haldol, and I'm going to come back in after you get the Haldol and the Benadryl, and we're going to check and see how it helps you. All right? Oh, you're going to do some vomiting. And again, we'll mask your face. And, all right, I'll stop this for right now. So sometimes the Haldol is actually just given IV push, 5 milligrams. A lot of our nurses like to just put it in a 500 cc bag and let it go with 25 of Benadryl, but I usually do about 5 milligrams of Haldol. Actually, it's ironic that in this very same room, we just had another patient last night with exactly the same complaint, and turned out to be a hyperemesis, and she got just a dose of Haldol, 5 milligrams, and nothing else besides the Benadryl, and she had like immediate recovery from that. So went home feeling fine. All right, the camera's rolling. So it's probably been what, an hour now. You've been sleeping because I think the Phenergan knocked you out too, but when I left probably an hour and a half ago, and I've checked on you a couple times in between, but you were still vomiting. That was just as the Haldol was starting to go in. So anyway, that you just basically, after you got the Haldol, you stopped vomiting, your belly pain went away, and you're actually feeling like you're ready to go home. All right, so we didn't do anything more than just really the Phenergan one time, which didn't work, and then we gave you the 5 milligrams of Haldol. The marijuana issue, though, you'll cut back on the marijuana or stop it for a while, and because I think that's appears to be the problem here, and so now you know what's going on. So we're going to get you home because you're still tired. It's getting late in the evening, and I think that Phenergan has got you feeling sleepy. So I'll just need you to sign a release on this. All right? All right. Thank you.